So now it is my honor to introduce you to Dr. Mary Val Palumbo, who is an advanced practice nurse and a professor emerita at the University of Vermont Medical Center. And Dr. Palumbo works closely with Dr. John Taylor, who some of you may know at the UVM Memory Program, and serves as the co-director for the Vermont Alzheimer's and Dementia Care project, which is pretty newly launched, and so she's here to share about that project with us today. Thank you.
Great. Well, I was also an incontinence specialist, so if you need to get up and go to the bathroom, this is quite a long time, and that's Tiffany's. Do you want to, who's in charge here? Oh, here we go. Okay. Is that, oh, okay. So first of all, I'd like to say it's so nice to be in a room of caring, smart people who've worked on this terrible problem for quite a long time. There was a group called the Hub and Spokes Alzheimer's Group that has been working behind the scenes on the project that I'm going to present to you and many other projects. And the last time I actually saw Dr. Levine in person was February of 2020. We were in his office because we couldn't find a conference room or something. I looked over at his standing desk. I was like, wow, that's a big standing desk. And he said, I may have to leave during the meeting because I might be called to Montpelier. He was called to Montpelier for the COVID crisis. I watched him on television for all through that. So thank you for your commitment to Alzheimer's disease. You had to take a little break and go deal with that COVID thing. It's wonderful to see you back. And all the other people who have just been committed to this for quite a long time. And it's nice to be in person, but thank you for COVID to open it up to people online, in your pajamas, whatever. This is an important topic, and we want you all to hear. So as we know, this is a growing problem in Vermont. We're anticipating 17,000 Vermonters diagnosed in just another year or so. But one thing that has come to our attention is that this population is really at high risk for hospitalization and emergency room visits. And reducing the hospitalization of this group to 19.1% from 23.5% is a healthy person's 2030 goal. So we are really focused in this project that I'm going to tell you about in trying to get people not hospitalized, not in the emergency rooms. And we're also acknowledging that the care of people with Alzheimer's and related dementia and their caregivers is complex and needs a team approach. And thank you, Dr. Salloway, and your wife for speaking about the role of nurses and other healthcare professionals, physical therapists, occupational therapists, navigators, case managers, because we need a team approach to this hard problem. So the purpose of the new program at the Memory Center was to implement this new model of caring at our specialty center. So we're a little bit clogged up at the memory program, and that's one reason why Dr. Taylor isn't here today, because we didn't know about this 6 months ago. So we make appointments for people 6 months ahead, and 4 people who were really wanting their diagnosis this morning would be canceled if Dr. Taylor was here. So you got me, my patients got pushed to the afternoon. But anyway, so we really were aware through our work with the health department and Dale of the UCLA Alzheimer's and Dementia Care Program that was really working with nurse practitioners, PAs, that's physician assistants, and dementia care assistants to create this model of care management that was quite successful in the UCLA model, and they were expanding it across the country. So we wanted to see if we could have a model replicated here in our state. So this is a little bit of the background that went into planning this hub and spokes. You might be familiar with that term from that being used with opiate addiction. So we thought, okay, well, can we build on a successful model looking at our specialty clinics as the hub and little spokes that can reach out to some of the rural places that don't have access to our specialty clinics. So what has been funded is I'm the project director, and that's funding through the Vermont Health Department and the BOLD grant. We also have funding from the University of Vermont Medical Center, the Foundation Endale, to support our dementia care specialist, who is a nurse practitioner, who's an adult nurse practitioner and psych nurse practitioner, and her name is Christina Haggard, and myself, to be trained by UCLA to have the title of dementia care specialist. So that's what you were talking about, these models that will increase our level of expertise. We also have money from Dale to have trained and supported our dementia care assistant, who is actually a medical assistant. So she's not a licensed professional, but has big interest in Alzheimer's. She had experience from the memory program. And we're also still paying UCLA to train us, consult with us, and having been a nurse practitioner in this field for 15 years, so delightful to talk to other nurse practitioners who are doing the same work and sharing our horror stories. So that's been invaluable. So the specific objectives were to provide the training to 2 nurse practitioners and 1 staff member to implement the dementia acuity classification system. And this is how we determine who's at risk for hospitalization, who's at risk for emergency room visits, and to develop and implement individualized dementia care plans in collaboration with the primary care provider. So we're not taking over for primary care, but we are sharing our expertise in the management of behaviors, caregiver depression, caregiver needs, all that stuff. And hopefully to free up our neurologists to focus on the diagnosis of the complex presentations. And we're also evaluating the program. It will end next September for cost effectiveness, for patient and family and provider satisfaction, and the potential of continuation and replication in other rural areas. So I'm going to spend a little time to show you how this UCLA program works. As I said, there's a number of places across the country that are using this model. So the designated dementia care specialist manages a panel of patients. Right now, 6 months in, we have 40 patients that our dementia care specialists manage. We have regular contact through phone calls, virtual visits, and in-person visits. And there are billing codes that do support that we hadn't been using in the past. They're more care coordination codes. So we're trying to make this a sustainable program. So this color-coded dementia acuity schedule is red being most at risk for hospitalization, yellow, some risk, and green, they're doing pretty good. So the red patients we are calling more frequently. We're calling their primary care providers and their care coordinators and other things. And we're also involved with the UCLA research to look at patient outcomes and caregiver outcomes, and to demonstrate a return on investment. So this UCLA program really began in 2011, and they had planned 250 patients, but shortly after that, it was expanded to 1,000 patients. And as of August 2020, over 3,500 patients had been enrolled, and they have an active waiting list. So this is a little visual of how it works. Is we're really looking for people who have a diagnosis of dementia, either from our roles at the memory program or the primary care provider. They also need a care giver, which somebody mentioned, the bachelor men who live on a farm in rural Vermont in an old farmhouse, still driving. They're my worst dream. But, you know, sometimes some caregiver will show up, a neighbor that or something, but really this program really relies on this caregiver to do some assessment on behaviors and the person's depression. I don't know how many people I've talked to in my clinic with Alzheimer's disease. I say, you know, how's your mood? How are you feeling? Oh, I'm fine. You know, it's that generation of people that aren't likely to admit that they have a poor mood, but when you talk to the caregiver, and they have some very nice tools, the UCLA program, that the caregiver is actually assessing for depression so that we can treat it, and that's really helpful. So there's this co-management with primary care providers and providing comprehensive care based on the health system and the community. So if the community has an adult day program, we're talking to the adult day program. If the community has assisted living, we went out to visit some of the assisted livings in our area, and I had always thought it takes forever to get in, and was pleasantly surprised to see that there were some openings in assisted living. So let's really utilize our resources that we have. So the dementia care specialist, talking about this new workforce that we need, is an advanced practice provider, a nurse practitioner, a clinical nurse specialist, or a physician assistant. And they can be healthcare system based or outpatient clinic. And as I said, they co-manage. The pharmacist is also a very important team player with this, and the psychiatrist too. And so the goal is about a panel of 250 a year for a full-time person. Then the training that we went through was online, 22 modules. There was weekly Zoom meetings with the UCLA people, and there's also available office hours. The dementia care assistant could be a licensed nurse or social worker or non-licensed trained staff person. And this person in our pilot program is reaching out and doing some scheduling, also being communicating between the primary care provider and our specialists, and can really identify someone who's in crisis. This is a look at our acuity level classification system, very specific how someone gets classified as red, yellow, or green, and what the follow-up should be for these people. So that's been helpful for us. So right now, we are conducting these in-person needs assessments and developing a plan, and it could be a plan that includes remote visits and monitoring and revising the plan as needed. So we're working with the area agencies on aging. Hospice, I think, is an untapped resource. So we're trying to encourage more families to sign up for hospice sooner than later when they qualify. As I said, the assisted living facilities, adult day programs, and the Alzheimer's Association, and our new dementia family caregiving center, which is virtual but is very helpful in talking about other resources that are available for families. And our newest thing is that we have expanded our services down to the Middlebury area. The elder care services is in a very large building that houses their adult day program. And working with this group, the hub and spokes, the person who runs that organization said, we have room, we could take a provider down in our area once a month so that we could extend the availability of expertise in managing dementia to this rural area. So we've already had our first month there, and it's going well, and it looks full. So now I'm going to tell you a little bit about our first 6-month outcome from April 1st to September 30th. We scheduled and had participation from 32 patients. There were 11 that were undecided or standby. I think a lot of times the caregivers are so overwhelmed, particularly the ones that are in a sandwich with their younger kids, and just not sure, I don't know if I want to sign up for more intervention. I'm just like barely getting it together. So that there's a little bit of that. We had a couple transfer to nursing homes, which, our goal is always patient and family focused, but sometimes the nursing home is the right decision for the family, and of course hospice care too. We have had some inactives and had 6 scheduled already in Middlebury, so a total engagement of about 54 for the first few months. And this is our age range, no surprise. The 70 to 80-year-old group is the largest. And I have to say, at the Memory Center, we get a lot of people coming for a diagnosis, 85 years old, and the families bringing them in. It's not that we don't want to see those people, but we feel that the primary care providers might be as equipped to make a diagnosis at that point. And we have done a lot of work, this little group, with the ECHO program, reaching out to primary care providers. We have online modules. We are available for consultation to help a primary care provider. And there's a lot of nurse practitioners that are providing primary care to make a diagnosis so that plans can start to be made. So we're talking about this problem out in the open. So this is the way the dementia acuity classification looked prior to our program. So looking green, yellow, red, the first column is the year before we started this program, and this is at the memory program. we had 68% the green. So we'll see in 6 months, call us if there's any problem. And only 5% yellow, red, 26%. Since we've started this program, and this is a little bit lower number, 19, we've really focused on the ones at highest need and highest risk for hospitalization. So in 2023, the high-risk patients were found to have more emergency room visits, more falls, required an increased level of supervision, and their caregivers were experiencing more stress and having more safety concerns. And so just in starting this out, I think that the caregivers feel more supported. And this is just beginning, but we're hopeful. So in conclusion, this program aligns with the goals of providing the patient and family-centered and value-based care to avoid unnecessary hospitalizations and emergency rooms. And the last place you want to be if you have dementia is the emergency room, and God forbid you get admitted and sit there for a really long time. So that's our goal. So I have time for questions. Yes.
So is this based on the guide model?
I'm glad you brought that up. So Dr. Rubin at UCLA started this program before GUIDE. So GUIDE is a Medicare reimbursement program for providers who want to take on the dementia management. It's almost like kind of a packaged care. And Dr. Rubin and his group really informed the policymakers about that. And I think there's about 18 across the country that were allowed to be in the pilot project called GUIDE. And it will be over 8 years, and they'll look at outcomes.
Did you apply for that?
No, and I'm glad that I didn't. Yes, just those networking calls from my colleagues across the country are saying that the requirements for that are really monumental. 3 or 4 hours to admit someone into the program. So kind of glad I didn't raise my hand, but I think we're doing very similar work, and we're learning from their experience, and hopefully Medicare will learn from the experience too. Yes?
Over the last 10 years, I've had annual physicals, and only one out of those have I had a screening for cognitive deficits. I don't know how to word this, but is it possible for you to, in your interactions with the primary care, to encourage them to do more screening? Because you have these guys that you were describing
Yes.
that are in a row, and if they were to get into the doctor's office, that would be an opportune time to actually see where their cognitive
Yes.
status is.
I think that's a great point, and you must be a young man, because Medicare annual wellness visit includes a cognitive screen. And I know that One Care Vermont and other organizations have really been pushing the use of the Medicare annual wellness exam, which includes the cognitive screen, as something to do. But I think your question: what if you are 50 years old and you say, I have worries about my memory? Is your primary care provider able to address that? And we have been working on that. For someone who's under 65, it might be really important to be referred to a specialist, a neurologist, the memory center, to get a full battery, a full workup, and also,
Most of those guys on the farm aren't gonna do that.
no, that's right. Other questions? Yes.
I noticed in your numbers that the one person was sort of lost to hospice. If somebody goes on hospice, are they then not able to participate in your program?
Yes, that would be a point when they would be discharged from the program. So we are looking for, an acceptable result, and that in that case, that was a good result for the family, because hospice opens up more services. And people have to say, we're not going to call the 911 anymore. We're not. And sometimes that is such a big conversation,
There's so many people in our memory care unit that are on hospice that are clearly not actively dying, that will be on hospice for a long time. And often, even though they're DNR, do not transfer, it's still a struggle. The families often represented in that moment.
Yeah, there's a lot of guilt and a lot of baggage about saying, no, we're not going to bring them to the emergency room anymore. Yeah, yes?
I have a question about sort of the gap between resource availability and need. One of your slides said 17,000 Vermonters, right, projected. How many people can we currently support in Vermont at an adequate level relative to that 17,000 number?
Well, that's a great question. I see gaps all the time. I see gaps in people who don't have any resources to consider assisted living, and there's not enough adult day programs. And, these aren't things that, we're paying healthcare dollars for, but we really are, because they're going to show up in the emergency room or get stuck in acute care. And so it all comes out in the wash, but it doesn't seem like we've been able to close those gaps.
That's my concern, is that I think of that 17,000 number, how many people can we deliver true excellence in care in our state? And it's a fraction of the 17,000 number. So
Yes.
That's just going to get worse. So I feel like the whole conversation is awesome, but there needs to be this huge moment. This is my mom, who's been assisted living. Very out for both.
Yeah.
But I worry about that increasing divide, and what happens is you have a sliver of people who have the resources to get excellence in care,
Yeah.
and the vast majority just don't.
Absolutely.
I feel like that's something that needs to be.
Yeah. Okay, who has the magic wand? Last question.
My question is, what do you do about the disincentives from Medicare? When my friend's mom last year had Alzheimer's, she did end up in the emergency room. She did end up for long periods of stay. The problem was, in order to get into a nursing home, you had to be hospitalized for them to pay their 100 days.
Oh, there has been a change to that. Yes. A primary care provider can admit someone right to a nursing home now. So that...
And that would start the 100 days for them?
I think so. Whether it's skilled or not, it doesn't have to be a skilled, like a rehab. But I have had some of my patients go right from their primary care office to the nursing home. Any other comments on that? Any other comments on the gentleman's question? Who's got the magic wand to fill all these gaps?
There is more Medicaid money coming into through ERC. I know they've expanded. I don't know the numbers, so I can't even manage my own checking account. I know there's more money coming in for reimbursement from Medicaid for people in assisted living.
Good, great. Rhonda?
Well, I just want to say I really appreciated Bill's question to us, all of us really, and how, Bill, we're trying to answer your question, in building that capacity. And each of you is invited to join that conversation monthly, first Thursday of the month, 9 a.m. And we've been doing this for years, but we're starting to see more capacity at the regional level in terms of like hub-like. And more, I think, provider teams, because right, it's all about a team care, being interested and the participation on the 3 Project Echoes that we've had on dementia, both for beginning practices as well as advanced practice, really robust attendance. So I think it's a slow journey, but I do think that through conversations like this, planning and execution, we'll do the best we can, but I think we're getting better all the time. And Mary Val, you're a leader in it, so thank you so much.
Thank you, Rhonda.
So thank you so much to Mary Val, and I echo what Rhonda said, and I think I'll just say that as we build the infrastructure, it makes scaling up easier. So all of these programs, ones that we heard about that we may be garnering inspiration from Dr. Soloway, the program Dr. Palumbo talked about at the UVM Medical Center, and a lot of work that's being done on the field is all about laying the groundwork so we can scale up. And then I can just put my Alzheimer's, not state of Vermont hat on here and say, this costs money. And older people typically do not get their share of our state's budget. And I loved when I met with Dr. Bowen, one of the things she said is that when we underfund programs for older people, the weight falls on the care partner's shoulders. And so I really appreciate that all of this work has drawn in the importance of not just including the care partner, but assessing their well-being as well so that they can live a healthy life for the rest of their life too. So invite all of you to join that. We are now at break time. For those of you that don't know, there's bathrooms if you go to the end of the hall. The men are one way, the women are the other way. And let's take 10 minutes, so we'll come back here at 11:10 for the last part of our presentation today. Thank you so much.
Okay, I want us to have time to move to a very important topic, one that we hear a lot about and work a lot on, which is what are the resources out there? What, if I'm a primary care provider or advanced practice nurse or care coordinator, what can I tap into in order to help me do my job in brain health and also in dementia care? So we are so excited that through the Alzheimer's Association's hard work, a new state dementia coordinator position was created. And even more exciting is that we have the right person in it, Tiffany Palmer, who is amazing in her work in connecting the dots. So we're going to hear from Tiffany today. And we'll have time for Q&A as well. So over to you, Tiffany.
Hi, everyone. Welcome back.
Pick up my computer. Okay. And the presentations are down here. Tiffany? Should work. And it should be on presentation mode.
Everybody, I just want to acknowledge my mistake. I had a staff person, Tiffany Palmer, who is not this, Tiffany Smith. Someone just came up to me and was like, did you change your name? No. It was me.
Tiffany Smith, nice to see you all. So sure, oftentimes, depending on if you are working within the medical health network, it is difficult to know what is available in community for individuals who are experiencing memory loss, cognitive decline. And so for this session, I'd just like to share some of our Vermont statistics with you. Then we'll look through community services and supports that are offered through a variety of funding sources and programs, and then a slide of resources. And I just want to share that in this presentation, we're using the word caregiver and care partner interchangeably, and it really just to reference any unpaid person. This could be a family member, a friend, a neighbor, who is assisting with or providing care to somebody with dementia. And so looking at Vermont, we know that more than 13,000 people over the age of 65 are diagnosed with Alzheimer's disease. And this is Alzheimer's disease. It does not include people who have mild cognitive impairment or another dementia, and does not include people under 65. And in 2023, there was more than 19,000 unpaid Vermont caregivers who provided 28 million hours of unpaid care to a loved one with dementia. And we know that caring for a person with dementia is very challenging. 61.5% of caregivers have chronic health conditions of their own. 35% of caregivers are reporting depression, and 10% of caregivers are in poor physical health. So looking at community services and supports, we have 2 dementia-focused statewide resources available, and that's our Alzheimer's Association that offer a 24-hour helpline. There's licensed social workers who are available to provide telephone support, and they offer a variety of education and training, support groups, and they also provide referrals to other community services. You'll notice in the slide deck that there's highlighted text. Those are links, and so you'll receive a copy of this and be able to sort of explore these links once you look through the slide deck. Another dementia-focused statewide resource is our Vermont Dementia Family Caregiver Center, and they offer evidence-based training and education. I'm going to talk a little bit about their programs that they offer there in another slide. They provide comprehensive consultations and referrals. So someone who goes to the center will meet with dementia-capable experts, and then they will also be able to refer them out to home and community-based services, as well as other clinical and medical services. They have licensed clinical social worker support that is in person. They provide therapeutic groups, and these can be covered by private insurance. And then they also have a volunteer peer-to-peer mentoring program. And that center would like you to know that for medical professionals that they serve as a gateway to specialized services that include disseminating information, referral for services, identification of resources to support primary care, and physicians and their teams across the state. And they collaborate with academic entities, community partners, and the Vermont Hub and Spoke initiative to assist community providers in identifying resources for patients with dementia. Looking at our Older American Act services, there's very small eligibility to receive these services. It doesn't require anything other than to be an older adult who is 60 and over, or a care partner or caregiver who is 18 and over to receive their caregiver support services. And this federal program, federal and state program essentially, prioritizes individuals who are over 60 who are living with Alzheimer's disease or related dementia, and they also prioritize adults who are 18 and over who are providing care to individuals living with dementia. And in 2020, the act was federally reauthorized to include people living with early onset Alzheimer's, so individuals who are younger than 60, as a population who can receive services and supports, including their caregivers. And the Older American Act prioritizes also those in greatest social and economic need. And the purpose of these community supports is really to help older adults age in place. And we know that's very important for individuals living with Alzheimer's to really remain in their homes and in their communities to thrive, and really try to achieve that through 3 key strategies, such as supporting those core home and community-based services, building partnerships that leverage additional public and private resources. And I know it's been spoken to today about the value of innovation and looking for ways that can ensure those continued effective outcomes. So these community-based services that are funded through federally and state funds are provided through our area agencies on aging. And here's a map that shows those service areas. Some of you may be familiar with AgeWell, Southwest Vermont Council on Aging, Northeast Council on Aging, Central Vermont Council on Aging, and Senior Solutions. All of these agencies offer 5 core services under this act: elder rights, caregiver support services, nutrition services, health and wellness, and then supportive services. And all those are provided using a person-centered approach and really look like connecting individuals with services such as providing personal care, transportation, meal prep, as well as congregate meals and home-delivered meals, access to adult daycare, home modifications for access to safety, grocery shopping, and others. And the best way to get connected to your area agency on aging is via a senior helpline, which is at the bottom of the page, or the V4A website. Thinking specifically now about caregiver support services, all caregivers of any older adult, but specifically older adults who are living with dementia, can receive clinical counseling individually or for their families. Respite, and this is usually in the form of providing financial assistance for in-home, out-of-home, overnight, short-term residential care, and also provides support for a self-directed approach. So individuals can choose who will be providing care in the home and can also provide training for that individual. Caregivers can also receive case management to help assess the needs and arrange for care, and really put together a package of services that would meet their needs and the needs of the person they're caring for. Access assistance, again, just really helping a caregiver navigate what services are available and providing warm handoffs and referrals to the services that would provide the support they need. And supplemental services is also a federally defined source. It's really broad. It includes financial assistance to purchase goods and services that are provided on a limited basis to complement the care provided by caregivers. And this really can be anything such as assistive tech and home modifications, again, for access and safety, even something like incontinence supplies, medical transportation, durable equipment. Another opportunity for caregiver support is through the Veteran Affairs Office. They have 2 programs to provide caregiver support. One is their CSP, Caregiver Support Program, which provides peer support mentoring, skills training, coaching. It is sort of the lowest barrier of caregiver support through the Veterans Affairs Office. They have another program that's comprehensive assistance for family caregivers, which does offer enhanced support, and there is eligibility that the VA will determine for those individuals needing care and caregivers, and it does provide a stipend. Another program that provides services and supports for individuals living with dementia is Choices for Care long-term care Medicaid program, and that does have a clinical and financial eligibility that is determined by the state. Once somebody is determined eligible and on program, they really have the option to receive care in-home, in an adult family care shared living home, a residential care, assisted living, really wanting to help individuals live in the setting of their choice that provides the care that they need. And there's also additional services that are available, such as case management, personal care services. And I provided some links here about eligibility and application process, but you can also find information through the AAAs on how to help individuals find out more information and consider applying. Thinking about evidence-based programs, so these are programs that have been studied and proven to provide positive outcomes. There's several that are available through the state. One is T-Care, and this is a program that caregiver support leads use within our AAA to assess a caregiver's stress and burden, and then provides resources for them that match with those areas of stress and burden and where the caregiver is struggling, and helps connect them to services across the state, and that is available in every AAA. Home Meds, which is a home-based medication management program. Individuals will go into the home and just help individuals sort through prescription bottles and sort of reconcile what they might be currently prescribed, what might be some medications that they're no longer prescribed but are still in the cabinet and really they don't need to be there. And that's available in right now 2 of our AAA regions. Tai Chi for arthritis and falls prevention, that is available statewide. True Alta is a new program, an online cloud-based system that 3 of our AAAs have utilized that is accessible 24/7 to caregivers and also provides some telephone and online support, but really covers all topics that caregivers might be searching for information on, whether it's how to manage behavioral symptoms, how to manage incontinence, or what are signs of cognitive impairment. PEARLS is a program to encourage active, rewarding lives and provide support to older adults who are experiencing later in life depression. And CARES is a program that is available through our Dementia Family Caregiver Center. Again, this is a statewide dementia-specific resource. It stands for Coaching, Advocacy, Respite, Education, Relationship, and Simulation. And so it is a program that not only provides training and education, but they have trained facilitators that organize a simulation of an experience of someone with dementia, so caregivers in real time and in a supportive environment can learn how to respond to challenging circumstances when caring for a loved one with dementia. TEACH stands for Training, Education, Assistance for Caregiving at Home, and is a little bit more of an initial program for caregivers who might be new to caregiving. And again, that's through our Dementia Family Caregiver Center, and that is available to individuals statewide. And Ageless Grace is a new program that's come out of our Central Vermont Council on Aging, and it is seated fitness, but exercises that are specific to target the body and the brain. And that can be attended by caregivers and the individual who is experiencing dementia. And we're also really proud to share some programs that we really consider as innovative around the state. One is a volunteer respite corps that has been developed by AgeWell in our northwest part of the state, where they have found volunteers who are very interested in providing respite. They've developed a curriculum to train them and support them through providing care, and they prepare them with families long-term. So they're meeting with families, determining if they're a good fit, and building a relationship where they're providing respite ongoing to that individual specifically and their family. In our southeast region, for several Vermonters who might be receiving services through Dartmouth Hitchcock, they have a Connect Share Care program, which is an online peer support program for care partners. And we also know that there's several virtual and in-person offerings. And so prior to 2020, many of these programs were really offered in person, but we were able to develop hybrid models for memory cafes, support groups, education and training, and other programs. So caregivers can connect virtually or meet in person, whatever suits their needs. And also Dementia Friendly Vermont. This is an initiative of our Governor's Commission on Alzheimer's Disease and Related Dementia. It's using a national model of Dementia Friendly America, but to connect with sectors of the community to deliver toolkits and guides that help organizations and businesses, home and community-based organizations, libraries, connect them with guides that will help them become more dementia capable and providing education so that really they can support people who are still living in community and as well as caregivers. Also very proud of the village model living that's in Mansfield Place, which is more, even though it provides nursing home level of care, it's in more of a community and home-based setting. And has been very successful and is also a model that's used nationally and globally. And the development of our hub and spoke model with electronic health record integration, and this is a group that meets monthly to really look at how dementia services on the clinical medical side and community side can coordinate and work together, and what models are being used that are successful, and how to sort of expand those and make them available to any organization that's interested. And also looking again at statewide resources, there's some additional community resources that can be explored. Certainly community and senior centers, depending on the region of Vermont, provide and create programs that are really specific to their communities and are great places to find resources and find support within community. Southeast Vermont has several regional CARES communities, and Demerson CARES, that's a link to their site, is one of them that again, are really personalized services and help all individuals who are aging and their caregivers with different tasks in their community. Onion River Exchange Time Bank is an interesting model in central Vermont where people can donate service in time and then bank time to also then receive service and help around their home. Faith-based organizations are also a place that we recognize that there is individualized help depending on the region that individuals live in. And Front Porch Forum, although it's different region to region, it is a great place to sort of look for assistance or help or materials that one might need. And so really thinking of how communities themselves communicate with each other and can provide resources. In 2020, we did develop a virtual toolkit and guide document that is posted on our Dale website, but we've also shared this out with several partners. And so depending on caregivers' readiness to identify as caregivers or their readiness to reach out into communities, these are a series of links to virtual supports to help caregivers sort of see what is available, also some education that is available to help improve their caregiving skill set and also provide support. And so these are various things like videos, if anybody's familiar with Teep of Snow, sort of what that is to provide support to someone to help promote the ease of personal care or communication, but also this could be phone apps that are readily available to caregivers. AARP Home Alone Alliance provides a lot of videos on how to assist with feeding or what it is to provide care in the home. And there's even a resource there for helping manage finances when caregiving becomes a financial burden. And so lots of good guides there. Also some virtual support communities that are national, and some of them have also state breakouts, but things that are accessible, whether it's virtual support or phone support, and listings of local support groups. And then supports for living in your home. We really want to make sure that caregivers know where to reach out when they're needing assistive devices or home modifications, and that is area agencies on aging. That's the best place to connect with the resources to purchase that work and also find individuals that can help bring those items to your home. And again, within this virtual toolkit, sharing it with caregivers, the information on applying for choices for care in the long-term Medicaid. Also just taking this moment to share what is a list of our Aging and Dementia Services Network. These are organizations across the state, but I think it's certainly growing as we build more of a movement to increase coordination among organizations and make sure that services are provided regardless of if caregivers or individuals with dementia are coming in through health networks or coming in through community organizations. These are a list of other larger entities that can provide support. And that's it. Thank you all for listening. Does anybody have any questions? I can go back to any slide, but I do.
The last one, there was Vermont 211, what's that?
Oh, 211 is a statewide helpline. It's not specific to older adults, but they do carry a lot of resources and information. You can call 211 and you'll be connected with an operator, but I believe also their website is a resource where you can, they have a square that says older adults. I believe they also have one that says caregiving, but it's a great resource to find, gosh, everything. I don't know how I would really, medical providers, plumbers, transportation. It's really a statewide resource. Yeah, definitely explore that.
Thank you so much for this, Tiffany. Very helpful to see everything put together. I also just want to shout out Tamsin and Abby, who are also doing evidence-based dementia care services in southern Vermont. Chester, is that right, Tamsin?
Yes.
Yeah. So just as another resource for anyone in that region.
Thank you.
Oh, wonderful. Yeah, and let's connect afterwards because I'd love to add you to this presentation and make sure we get you linked up on the resource page. So thank you.
I'm curious about the dementia-friendly community. I observed that in New Zealand when I went to New Zealand, and they had kind of stickers on like a store, like a convenience store where the staff had been trained. You know, have you seen anything like stickers or any?
Yeah, and that is a component of the program, is to help sectors of the community, once they've adopted some elements of the toolkit and the guides, is to then be recognized so that as people move around community and we think about downtowns and businesses, that they would know this is a dementia-friendly community. We don't have any of that yet, but what. Yeah, no stickers yet, but it's certainly on the list. We do have one standout community, Middlebury, that has really taken on the dementia-friendly community work. They've engaged, they're very much still in the planning pieces, but they've been really successful at engaging all of their community sectors. They have the municipal leaders, police, emergency response, library, all of the aging services providers there, and so really moving forward. And that was through their college there and some grad students that chose this as a community project, but it's really now broadened into a lot of dedicated community leads that want to build that out. And so that's really our standout community that's taken those steps and put a lot of work into kind of getting the infrastructure set to then work towards the stickers.
Yes.
I was at the Vermont Parks and Rec Association conference recently, and I noticed they were a great source of programming for older adults as well, in terms of healthy aging, and especially when it comes to that socialization piece. I was just really impressed by the range of programs that were offered specifically for older adults towards healthy aging. So I just wanted to mention that too.
Yeah, fantastic. Yeah, and I think that when we look at senior centers or community centers, as they're referred to in some places, there's so much going on that it's hard to capture all in a slide, but really reaching out to whatever that organization is and where you live, there's so much more going on than what is even on our radar.
I think that's my question. I've been texting my wife resources that have linked up on your slide, because she has all the parents right now. And I guess my question is there a single point of entry for Vermonters who could ask this sort of broad, well, I have aging parents, what should I do? Like, where do you start as a consumer in Vermont and talk to somebody that somehow magically has knowledge of all the parks and rec? I had no idea. They somehow magically has all this knowledge. They can help guide you through and get the best possible sort of support. Like, how do we do that in our state?
Yeah, so I think that really, when we're talking about individual dementia, there's likely three main points of entry, and that is Alzheimer's Association, the Dementia Family Caregiver Center, and then the regional AAA. Those would be starting points. But I think what we're working towards, and does exist in some ways, is a no wrong door model, where it is accessible, and that the more that medical and health network providers know where those resources are, how they can become connected with home and community organizations, it'll be less specific of like you have to go to this one place, or that wherever you go it will sort of lead to maybe those three: Alzheimer's Association, the AAA, Dementia Family Caregiver Center. So a little bit difficult to map, but certainly anything, any questions around looking for services supports as you yourself are aging, as you're caring for someone who is aging, or finding yourself becoming a caregiver in maybe more involved ways, area agency on aging it would really be a great place to start. And it's, a lot of this stuff is on websites, and you can sort of explore what it is, and then each agency has a helpline that can also kind of help dial you into a more specific support, like specifically transportation or nutrition, or what it is to find a congregate meal site or receive a home delivered meal.
There's also a lot of support groups too, that people going through the same stuff can also provide information and direction on things that would help as well.
It feels to me like it's not unique even to this space, but there's so many resources out there. They're all on different sort of siloed websites, with their own URL, and their own acronym. And there's so many. And I'm just looking for an easy button. Where it'd be nice to be able to, like, here's who I am, and here are the needs I have, go. And then somehow, like, magically answers your questions for you and lists out all the services. That's like pie in the sky.
Easy button does not.
So, I just wanted to mention that there are 4 certified senior advisors in the state. I am one of them. I have Golden Guide Senior Living Advisor. Get a hold of me, and we can really tailor everything based on every person's unique needs in a specific area.
And are you, someone like you, available statewide, stem to stern?
Well, there's 4 in the state that are certified through the Society of Certified Senior Advisors. Yeah.
And are you funded, sorry, are you funded by the state? Is it a state position? Or
No, my services as an advisor are free directly to my clients, and I have in-network referral partnerships with home care and senior communities. Yeah. Yeah, you're welcome.
Yeah, wonderful, Alicia, thank you.
What hook gaps do you see in it? This gentleman, according to you, we need an app, right? There's an app that.
That's what I just said. We were just going to build an app for that.
Yeah.
Just put in all the resources, figure out where you are location-wise, and.
So that's a great idea. So in addition to that, what gaps do you see in anybody here? What are the gaps in the area?
Yeah, well, I think that there's certain challenges across services in Vermont when we think about the rural nature of the state, and so what it is to be in a location that has a lot of services around you. I think often we defer to like Burlington as sort of being this place where there's lots of services or lots of people, there's health networks and people are connected, versus sort of rural areas, and also how individuals want to seek out or receive information. Maybe not everybody is going online or clicking links and will receive that. So I think the best that our Aging Services Network does and our AAAs is try to, produce the paper flyers still, make links available, make people available via telephone, and also, several case managers or staff that would go into someone's home to kind of help connect with them and services. So I think that might be just what is the best way to reach folks and share communication with them could be a barrier. Anybody here want to share some? Yes, Angela.
I was just going to say, I think one of the major challenges or gaps in serving people with dementia is our workforce shortage, right? So whether we're talking about being able to serve someone in long-term care, adult day, in-home respite, whatever it might be, we don't have the workforce to meet the growing need for all of our older adults, but especially for people with dementia. I think that's a primary challenge and area of work we need to focus on in the state.
Is that gap quantified at all? Like, do you know if we need 10,000 more people or we need 2 million more people?
Right. Those projections are hard to do, and that's not an area of expertise at Dale, but what we can do is we ask our provider network. So, for example, at our home health agencies, they know that they have about a 1 in 3 PCA gap to be able to provide the services that are needed right now. So we can quantify to some extent, Bill, but not the way that you're thinking about how many direct care workers do we truly need. They do that, we have national data on that, but not Vermont specific.
One of the gaps that I see is availability of therapy for a caregiver where the therapist is already aware of how and what dementia is, so that when a caregiver comes for their first session, they're not having to explain the whole background and having to educate the therapist on what dementia is. Because if you can give a 10-minute spiel like you're talking about, that gentleman was talking about, and that therapist knows exactly where you are, they can jump into how can I support you as the caregiver versus this kind of education that seems to be backwards.
Yeah, absolutely.
And I would say the best resource for that right now would be the Dementia Family Caregiver Center, because they are dementia service experts, but they're also those clinicians that would, and they have the capacity to help people right now and do it statewide. But exactly, I agree. Rhonda?
I have a question for the room. So how do people feel about, given the workforce challenge we have, of integrating, whether it's robotic or other type of technological assistance for dementia support, dementia care?
I think caregivers would appreciate it, but I think it'd be intimidating to the dementia resident themselves. Are you talking about telehealth, that kind of thing?
Telehealth is a part of it, but I know there are pilots and maybe even now integrated services that, at least in hospital settings, are using robotic care. I read mostly about the detection of disease through machine learning, and that's getting better and better. What I don't hear as much or read as much about is on the care side. So I thought, to ask you, a room of smart, experienced people, what you are seeing and hearing.
So there's two things I have to say about that in regards to like robotics or electronics. One of the things that I think is really important is more of a proactive approach to health. So in the community we work in, we have a proactive approach to catching a person who might be at risk for falling, right? But that's not an intimidation to the resident that we're caring for. On the flip side, I'm not a proponent of robotics in regards to direct care, because I really believe in order to really value this vulnerable population, it has to be relationship-centered care, which comes from each of us.
Right. I concur. So a lot of what you're talking about, I agree. If someone has an injury, you can show them on telehealth, this is what we're dealing with. What do you think? But in terms of trying to do the investigation of symptoms, face-to-face works better than anything else.
And I think COVID brought that around, right? So in some cases, that's really good, but look at what COVID showed us as far as isolation. And so many of the population that I work with are kind of isolated anyway. A lot of times when I go into homes, just to sit there and, there's like a human body and I can talk.
Yeah.
That's huge.
Yes. So one of the things that we are working on as one of the efforts is to build more, as you heard today, more dementia, adult day, not just dementia, adult day centers, and increase the capacity to attend those that already exist. You had a really exciting mention this morning just around one that is getting created. Do you want to mention that too? So there's a grant to an organization in central Vermont that is working to create an intergenerational adult day center side by side with a child care center. So really that multi-generational model of adult day and child care where there can be connection and real growth and learning across the generation. So that they're in the planning stages because during the pandemic we lost adult day in the central Vermont area, and so that whole region is without adult day capacity. So that we're excited to see this new model, and potentially it could be a model for other places. I have one more question. This one's for you. Smith, not Palmer. I'm so sorry. Is what's on your wish list? Anything you want to mention
that you see, like, oh, I really would like that for Vermont, whether it's equity of services?
Yeah, well, equity of services is a huge piece. I think that in the last 7 months, meeting several people who are living with dementia, their caregivers, and also organizations supporting folks, that what might be available in one part of the state seems so alluring to them, and they really wish that they had that, and that, you know, it shouldn't be necessarily if you have to live in some specific area to receive a service. So certainly building, looking at those innovative models. I think our respite core is something that's in AWOL that's been so successful, being able to expand that across the state, you know, just knowing around workforce shortage, that if there are volunteers that are, you know, willing to take on respite work, and what that would mean across other areas of the state as it means to the folks who are participating in our Northwest region. You know, equity of services across the state, consistency would be wonderful. Definitely, yeah. And I think that, you know, and the other pieces too is just communicating the resources that are available. There's still so many people that I think might be caring for somebody who's newly diagnosed and just feeling like, oh, there's nothing. And so being able to make sure that they do feel that there are resources, especially in earlier stages of dementia, and really being able to get those supports before it becomes critical. And really being able to be integrated into community and services earlier. Yeah. So hopefully when you receive the slide deck, you know, my email is at the end. Please feel free to reach out to me. I'd love to connect with all of you and hear more about those barriers and challenges, and work to build out services in your area and provide toolkits and resources. Thanks so much. Oh.
Thank you. Yes, thank you so much, Tiffany. I think we should have you speak every week on this topic. So this is going to conclude our morning session.